All right, today we're diving deep into the science behind some really specialized clinical nutrition. We're going to be looking at a formula that's designed to help some of the most vulnerable patients out there. So let's get right into it. So here's the big question, right? For patients in the ICU or anyone in critical care, and especially folks going through cancer treatment, their bodies are just under a tremendous amount of stress. And what happens? You see this really significant weight loss and muscle wasting, and that can be a huge roadblock to their recovery. So the problem is, how do you give the body the right kind of fuel to fight back? And this is exactly where a targeted solution like Nourishmate Advanced 2.0 comes into play. It's built from the ground up to tackle these really high-demand situations with a super concentrated, scientifically backed approach. Okay, so let's really break down what this stuff is and, more importantly, who it's made for. Now, you really got to pay attention to those first few words, peptide-based and therapeutic. This is not, and I mean not, your average protein shake. This is a nutritional formula that's been specifically engineered for patients whose bodies are basically in overdrive. Think of it like a furnace that's running so hot, it starts burning its own walls for fuel. That's kind of what's happening. The body's breaking down muscle just to survive. So this slide gives you the highlight reel. I mean, it packs this incredible punch of protein and calories, right? But the secret sauce really is that it's peptide-based. That means it can be absorbed super fast, which is absolutely critical when someone's digestive system is already stressed. Plus, it's loaded with other functional ingredients, there's no added sucrose, and it's versatile. You can drink it or use it for tube feeding. All right, let's get into the nitty-gritty. Let's look at the science and see how this all works to build a real foundation for recovery. This isn't just some random mix of ingredients. This caloric breakdown is incredibly deliberate. You see that nearly a third of the calories come from protein? That is all about rebuilding and holding on to precious muscle mass. And then you've got the fats and carbs, which are there to provide that essential, sustained energy the body is screaming for when it's trying to heal. 34 grams of protein. Let that sink in. Per 100 grams of powder. That is a seriously high concentration. For a cancer patient who's dealing with muscle loss, getting this much high-quality protein is just non-negotiable. It helps them preserve their strength and supports their body's tissues during really grueling treatments. And that can mean better tolerance to treatment and a much stronger shot at recovery. And then there's the energy density. Look at that. A single 52-gram serving gives you 247 kilocalories. This is so important for patients who might have a poor appetite, maybe they have trouble eating, or they're on fluid restrictions. It's all about getting the maximum amount of energy in the smallest possible volume. Now, this is so important to understand. It's not just about the quantity of protein, it is all about the quality. See, this formula uses whey protein isolate and hydrolyzed pea protein. Now, hydrolyzed is just a fancy way of saying the protein is already broken down or pre-digested into these little tiny chains called peptides. This makes them incredibly easy for a stressed out gut to just grab and use immediately. And that PDCAAS score of 1.0, think of it like a 100% perfect score on a test. It's the highest you can get, which means the body can use pretty much every bit of that protein for repair. And this is where it gets even more interesting, because we're going way beyond just protein and calories. We're talking about powerful functional ingredients. You've got Silymarin and Piperine to help manage inflammation, which is a huge deal after surgery or chemo. MCTs are a type of fat that gives you quick, easy energy. And then, and this is critical, you have this entire gut support team. The prebiotics, that's the food for the good bacteria in your gut. And the probiotics, they are the good bacteria. Together, they help get the digestive system back in balance. And L-glutamine is there to support gut and immune health. A healthy gut is everything. It means you absorb nutrients better and your whole defense system gets stronger. Okay, so we've got the science down, but what about the real world? Let's look at how this is actually used day to day. Well, the good news is they made the preparation super straightforward. It's literally just 4 scoops into about 100 milliliters of lukewarm water or milk. No complicated measuring, no fuss, just simple, quick, and you know you're getting the right dose. So when should you take it? The general advice is between meals, or maybe as a snack before bed, just to boost that daily intake. But, and this is really important, this is just a general guide. Everybody's needs are different, so you should always follow the specific advice of a doctor or a dietitian. And this tagline, a buddy for your health, it really sums it up perfectly, doesn't it? This isn't a medicine that's going to cure anything on its own. It's a supportive partner. It's that buddy that gives your body the fundamental building blocks it desperately needs to fight and to recover. So, as we wrap this up,
It really brings us to a pretty powerful question. In the super complex world of critical care and cancer treatment, we focus so much on these amazing, advanced medical procedures. But what if scientifically designed nutrition, just like this, is one of the most vital and maybe one of the most overlooked pieces of the entire recovery puzzle? Something to think about.